right, first of all, thank you for staying tuned to independent television. And for all those who are tuning in right now because of Flipside, we are very glad to have you. Those watching on YouTube, those watching from our website, those watching on TSTV, GoTV, Star Times, and your regular terrestrial television, we're very glad you could make it a date with us today. My name is Daisy Leo Asikidi, and of course, we're talking about the other side of the news. March 11 was World Kidney Day, and everyone was talking about it, living healthy with kidneys. How do you survive? What are some of the challenges? But there were still a whole lot of issues that were not dealt with in the news. I mean, the time is really short. 5 minutes tops and all that stuff. But today we're going to devote a lot of our time. We'll continue from where they stopped on healthy living on Monday and deal with it. But you also know that the week before this was International Women's Day, and on that show we established the fact that the entire month of March is for women. So all kinds of women issues are supposed to be dealt with. So in as much as we're looking at the World Kidney Day, we're still going to focus our attention on children and women. So I have two people in the house that will talk about this with us. One is here to share his own personal experience because he's actually living with this kidney disease, and we need to know how he's doing it, get an insight about his life. And then I have someone else who is a professional, a nephrologist, a consultant nephrologist. But before you meet my guest, hold on, I'll just go on a quick break, then you meet them.
Our kidneys are too.
Thank you. It's still Flipside, and I'm Daisy Leo Asikidi, your host. So meet my guest right now. Seated close to me is Michael Ikwamusa. I've given you another name. Michael Ikwamusa is living with this infection and is surviving. Looking at him now, he looks good. So maybe we'll know how he's managing to do all of that. It's good to have you on Flipside today.
Yes, thank you very much.
All right, and then I have another man wearing white like me in the studio. He's a consultant nephrologist. Is Dr. OJ Ozigbe from University of Benin Teaching Hospital.
Thank you.
Good to have you on the show.
Thank you so much.
I will start with you before I go to Michael. So we just do like a run through. I know these statements, these questions were asked last week in our different shows where we talked about the World Kidney Day. So, but we'll just run through for those who missed out on it. So, first of all, what is kidney disease?
Kidney disease is anything that affects the function of your kidneys. Many times, most people don't remember that they have kidneys. All they remember is heart. But the kidneys are the two organs. Each one is about the size of a human fist, and there are two, and they stay at the back of your abdomen. They are responsible for so many things in the body. They are responsible for cleaning up the body, clearing out all the waste products. In addition to that, most people think it ends there, but the kidneys are also responsible for maintaining the chemical nature of your insides. And then in addition to that, they are responsible for helping form your blood, and they are responsible at the same time for maintaining your blood pressure.
That's a whole lot of function.
It's a whole lot of
so, but now we've been hearing about kidney diseases, and there are people watching who might have had maybe a relative who's been through it, who's passed on, who's still surviving. I personally have had a first-hand experience with someone close to me. She's passed now, but it was really hard. So, but what causes these kidney diseases?
A number of things cause kidney diseases. The most common around this environment are the infectious diseases, and they go ahead and there's an infection and it affects the kidneys. And then hypertension is also another thing that affects the kidneys, especially when the blood pressure is not well controlled. Diabetes is another thing that is coming up in this environment. Other infections like HIV, hepatitis B, for men especially, Well, I understand you said this women's, but
It's
for
okay.
men, enlarged prostate, which disturbs the outflow of urine, and then in a lot of other people, you find that there is small number of other things. You won't believe it, including things like malaria and drugs that people take regularly, feel-good drugs. Now, this is causing us a lot of problems. They finish work at the end of the day, they go ahead and take diclofenac, they take ibuprofen, they take all those drugs that make them feel strong, and then it begins to damage their kidneys, and it's quite a problem, especially in Benin City at this time.
So for a lot of us that self-prescribed painkillers, because you just mentioned one particular one, that is a painkiller that I know. Okay, I'll keep watching. All right, but who is at risk? Is there a particular sex or a particular age group that is most prone to kidney disease?
Previously, we used to say that those that were at risk were the older age group. But in developing countries now, especially Nigeria, we are finding out that those who are at risk are actually the most productive age group of 18 to 55. And it's quite disturbing. Like we talk about hypertension, we are now finding out that most men around the age of 40, especially to a lesser extent the females, develop hypertension. The number of reasons we've tried to look at that. And then diabetes is also becoming more common. High blood sugar is becoming more common as we adopt the Western style of living, as we think we've made it, and so we take more sugary foods and leave the old ones. Nobody likes to take yams and beans and anything now, but we like to take
soda.
Thank you
pizza.
very much. God bless you. Fried rice, jollof rice, and sugar-based products, especially. These ones cause pancreatic burnout. And then the occurrence of diabetes in the younger age group is on the rise, terribly on the rise. And all these things are risk factors for kidney disease. So if you have hypertension, if you have diabetes, if you have repeated infections, if you have prostate, enlarged prostate, if you have HIV and all these things, you are actually at risk for kidney disease.
Okay, now the person I had that had this kidney disease and she passed on, she luckily for everyone close to her, she had a child that's the only child she had, so that was the person carrying on. So when you see the child and
You
the child
tend
is
to
like,
remember,
yeah.
yes,
But is there any cure for kidney disease? I've seen publications on Google where they say there are certain foods that can repair the kidney. And if your kidney is repaired, I think that's practically a cure. Why? I don't know.
Well, you are right. If your kidney is repaired, that's a practical cure. But to understand why it's difficult to get a cure, you must understand that first, the kidney is a sieve, but it's not one large sieve. Each kidney is made up of 1 million small sieves. So when each one dies, it's replaced by scar tissue. And so it's difficult to get it back to function. But you see, there are two broad categories of kidney disease. One of them is what they call acute, which means it occurs suddenly over hours, days, or weeks. And usually it will show up easily. And at that point where it shows up, if you are able to stop what was causing it, yes, you can reverse the kidney problem. But the one that bothers us more is the chronic one, that it doesn't show up. The small sieves that we call nephrons just keep dying, and they keep being replaced by fibrous tissue. And when that happens, you cannot replace the ones that are already dead. What you can do, however, is to stop more from dying, or to reduce the speed at which the remaining die, so that you can preserve overall kidney function for a long period.
Wow. Okay. For those who have kidney infections, it's like the chronic one you just said. It seems like it's hard to even know that you have it because you said it's gradual. Well, how soon can someone who has kidney infection or kidney disease begin to feel the impact, to start knowing that, okay, something is wrong? Is it when it's way gone, or at the initial stage? Are there signs that you can use to know?
There are signs, but that's why I'm happy I'm here today, because unfortunately, until about 80% of your kidneys are damaged, you won't know that you have chronic kidney disease. So the thing that we have to capitalize on is that you should go for regular checkups. Actually, especially if you're at risk, once you are at risk, you should go for regular checkups. And those checkups are not very expensive. A urine analysis test, for instance, will probably cost less than 500 naira. And that could be a test that will let you know ahead of time when you are getting to difficult times with your kidney. But the kidneys have a large reserve, which is to say, if you have just 30% of your kidneys functioning, they would carry you. They will take care of you. And if you have 20% of your kidneys functioning, they could just manage to take care of you if there is no additional problem. But once it drops to around 15%, it shows up. And when it shows up, it's usually very late to do something about it. That is the problem we have with our kidneys.
Okay, so I'll come to you, Mr. Michael. We just had to run through all of that information because it's really, really vital. I want you to share your experience with us, how you found out about this health condition, and how long have you been dealing with this?
Yeah. Thank you very much. Actually, I was diagnosed of chronic kidney disease October 2018, and ever since then I've been on dialysis. It has not been easy. When I was diagnosed, first of all, it started with, I was thinking it's malaria or it's fever, I'll be sick. I was having chest pain, at times headache. I didn't go to the hospital on time. I was buying drugs from the pharmacy shop, from the chemist. So it was not got to a time, and also that my legs were swollen. So I had to run to the hospital to check. When I got to the hospital, the doctor told me it was already too late. They now had to place me on some medications for like a month. After then, just told me, he said, I have to break the bad news to you. The kidneys are already gone. So you have only two options. It's either you go on dialysis right now or you do a kidney transplant. And both of them, the financial implication is enormous. It is just too much. It's not something you talk about.
Okay. All right, Dr. OJ, you were talking about some of the, when you were talking about the kidney disease, it almost sounded like we're focusing more on adults. Who's listening out there might think it might be slightly different for children. But in developing countries, you said between 18 to 50 years. Well, now we're beginning to see lots and lots of children beginning to also exhibit the kidney disease issues. What could possibly be the cause of it? I have a video I'm going to play for everyone to watch of a child who, one of the children, these are teenagers though, one of them started going for dialysis at the age of 6. So is it that it's genetic? Is it genetic? Is it that, so that if there's an adult who has it now, they can know that their children most likely will get it? But why do we have these infections also in children?
Kidney diseases also affect children. In Nigeria, we are beginning to find out that more and more children are being discovered with kidney disease. Now we have a challenge. The first challenge was that, is it because we are now able to diagnose kidney disease better than before? Is that why we are catching them? Were those children dying in the first place and not being noticed because we couldn't diagnose them? Or are kidney diseases in the children actually on the rise? However, there are a lot of things that are hereditary, and we are beginning to go ahead and catch them, because you must also note that we have problems with diagnosis here in Nigeria. Advanced things are not there, electron microscopes are not there, things for genetic studies are not available. So it's actually an uphill task, but we are beginning to get there. So there are genetic causes. One of the most popular ones we are beginning to see more and more is polycystic kidney diseases. You just find out that the kidney that is supposed to be a solid tissue, like I said, about the size of a fist, gets filled with fluid, small sacs full of fluid, and then it stops functioning. Another thing that it's there in our environment is what we call Alport syndrome, in which case there's a problem with the gene, there's a mutation in the gene, it changes, and then it produces a kidney that does not develop well. And those kidneys develop scars, from scars to fibrous tissue to damage. Then there are also some things that it's unfortunate that has happened in young people, in children actually, but sometimes it doesn't manifest until teenage. There's a defect in the urinary tract. It's blocked partially or fully, and some doctors probably did not take note of it. The mothers and the parents did not take note of it, and then the kidneys begin to suffer damage. And by the time it is out, the damage is much. So one thing like vesical ureteral reflux, forget the name, and the posterior urethral valve, it just means that there's a blockage in where the urine comes out. Mothers can notice it by looking at the stream of urine that their small babies are passing. The stream should be able to jet out freely. If it doesn't do so, if it dribbles, something is wrong. Why it's unfortunate is that if those things are discovered early, we have surgeons in UBTH and in other hospitals, even in Benin City, that can operate and correct the problem so that the damage of kidney failure does not result. So another very common thing that causes kidney diseases in children is sore throat, streptococcal sore throat. Children will run a fever, have a sore throat, the sore throat heals, everybody forgets about it, and many years later they come out with kidney damage. And the reason is that not as if the infection damaged the kidneys, no. That infection is very similar to your kidney tissue. But the body recognizes that this is something that is foreign. So the body produces soldiers, or what we call antibodies, to fight those streptococcal infection. Many years later, because of the similarity of those streptococcal infection to your kidney tissue, the body starts to fight your kidney tissue itself, thinking that it is foreign, and it causes damage. And that is a very common cause of kidney failure in our environment. So you should check out your child, even if he has sore throat. Just go to the hospital, let them see the kind of organism causing that sore throat and deal with it early enough.
Okay. Michael, how has this whole ordeal affected you, your life? Do you work? Are you a worker? Do you have a family? How's it affected you?
Thank you very much. It has not been easy. Having chronic kidney disease is not something you wished for anybody. It has not been easy ever since. Right now, I'm not working because I'm always at the hospital. The doctors ask us to dialyze 3 times a week. If I go to the hospital 3 times weekly, when will I not have to go to work or go to do my business? We are always at the hospital for one thing or the other, most especially for dialysis. And the dialysis takes 4 hours of our time. There is pre-dialysis, you have to run some tests, and there's also post-dialysis, you have to rest. So it's time consuming. It has not been easy.
Do you feel pains? Does it interrupt your sleep or something?
Yeah, if you don't dialyze regularly, you will not be fine. You cannot sleep properly because your body will be swollen. There are a lot of fatigue, so many things. So if you don't dialysis is what keeps us going. If we don't dialyze, it's as if after some time or some weeks, we will be dead. That is the implication. If you don't go for dialysis, you are gone as a chronic kidney disease patient. So it has not been easy. We're always in the hospital, and the financial implication. A section of dialysis costs 25,000 naira.
3 times a week. That's
3 times a week. That's not the only thing. There are other things that comes with it. When you have this disease, you are always anemic. One of the issues, shortage of blood. When you go to the hospital, you have to buy blood. And there is an injection we also take, which is called erythropoietin, to help us get blood. That injection costs 10,000 naira. When you dialyze, you need to take that injection. So when you calculate the amount you spend, it's highly telling. That's why we are begging the government. We are trying to engage them. So because we believe in developed country, they do it free for their citizens. I think they use their taxpayers' money to do it free for them. Then when it comes to transplant, they place them on a waiting list. When they have a donor and they're ready, they will not do the transplant for them. But yeah, it's not like that. They just see us like people that will soon die one day. because it's the fact. When you go to the hospital, almost every week you hear that this one is gone. We lost somebody 2 days ago, even 3 days ago. So a kidney patient, even our former coordinator, we have an association, we just lost him recently. So it has not been easy. People always dying from this ailment, so they just look at us, these people, they will soon do their own and go. So it has not been easy. So we are begging the government to really help us.
Okay, I think we'll take the plea beyond just government. There are other private individuals, business owners that could also come to the aid of these people. But before that, we'll share some group of teenagers who are also dealing with kidney disease. They are undergoing dialysis, and I got this video from LiveDoc on YouTube. So we'll just quickly push play to that one before we get back to the studio and talk some more.
Our kidneys are two bean-shaped organs located against the back.
What are the challenges of being a teenager on kidney dialysis? Find out right now on Keeping Kids Healthy. Now it's time to meet those teenagers who have had to make hospital visits part of their daily lives. These kids have chronic kidney failure, and when you're dealing with a chronic illness, your day-to-day schedule has to change to accommodate your treatment. That can be especially hard for a teenager. There's enough to worry about, like just fitting in with other kids without having to think about changing your diet or making regular doctor's appointments.
I try to keep my mind busy, keep my mind off of the whole kidney thing, bad kidneys. Don't do your stuff equals death.
I'm here 3 days a week for 3.5 hours. You get bored, you know, sometimes you get sleepy, tired, like you want to go home instead of feeling there.
The day that you do get dialysis, afterwards you feel tired. But the next day, you're ready for anything. Hey.
As long as you're here with your friends, you know, you chill out. You know, it's good after a while. You hardly don't think about it.
Every time a new person comes in, we always explain, like, how we started, or like what kind of dialysis to take, if it's good or not. When I started,
he was the first one to walk up to me because I was nervous. I was like 12 years old.
Anyway, he was the first one to come up to me and say he wanted to be my friend. I was like, okay. You know, show me the ropes and everything, told me not to be nervous.
People telling me I have to do it, like my family, my friends, always telling me I have to do my dialysis. It's for my health, so I'm gonna do it.
It's not a fun process, but you know you have to live with it. You gotta deal with it. God picks certain people for this to happen to, because we know we can handle it.
I ask myself every day, why? Like it's there. It's not gonna go nowhere. I'm stuck with it for the rest of my life. As long as I do life day at a time, each day. That's about it.
We're no different from anybody else, except for the health problem, and we never let it get in the way.
All right, we're still talking about World Kidney Day, even though it's not today, but we're talking about it anyways. It's this whole month for them, for women as well. So I have two guests in the house, and I have Michael and Dr. Ozibe with me in the studio, and together we're talking about this kidney diseases and how to live with it and the effects it has. So I will just ask you two questions back to back, then I'll bombard Dr. Ozibe with several more before we leave. Okay. The video we played, we had the children in groups, like they try to give themselves joy, but I know even as much as they're smiling in that video, it's not all smiles. Outside the camera it might be hard. Are you married?
Yes.
Okay, so I want to know how you're dealing with the old mental stress that comes with knowing this, what you carry, or how do you manage it? Do you exercise? Do you go to the cinemas? What do you do to ease the burden?
Thank you very much. Yeah, like I said, it has not been easy, but the thing still remains that when you are able to dialyze regularly, you can live your normal life.
Okay.
You dialyze regularly, you take your drugs, and you follow your dietitian, or the food you are asked to eat. You follow the regular thing the doctor tells you to do. You can actually live your normal life. We have somebody in UBTH who has been dialyzing for 13 years now. So he has been on dialysis. So what I'm saying is that you can actually live your normal life, but it's not easy. It's not easy because your family, you depend on your family to, at least my mother, she has to go borrow money. She will sold her place, some of her, but even her land, just to make sure I don't die, so that she can pay for my dialysis. Because if she hasn't done that, maybe today I will not be alive talking. And because I've been dialyzing since 2018, so it has not been easy to calculate the amount I've spent from then till now, and twice every week. So it has not been easy, even for my wife and my family. It has not been easy.
So what's your routine like, even with this dialysis? Because you said you do it 3 times in a week.
Yeah.
So what do you do? You're not working now, so what do you do in between?
Yeah. Normally, I have a shop where I sell, but right now I don't go there often because I'm always at the hospital. But when I'm free and I'm okay, after dialysis I'm strong, I can still go there to assist in the sales. But most of the time, I'm always at the hospital. Yeah.
Interesting. All right, let's get back to you, doctor.
Yes.
We're also saying, what are some of the complications a child with chronic kidney disease is likely to face?
The complications are many. Many times, because of the low blood level, they get tired, they are listless, and they don't have energy. Then some would have, they could lose consciousness, they could be dizzy, they have nausea, they have vomiting, their appetite is very poor, and then if they don't dialyze regularly, they will bloat up in all the wrong places, so they have poor self-esteem. You take a look at yourself and you look different, you look sick, so really bad body image with yourself. And then some could just throw up at any time, and so then they have poor growth. Many of the children will be looking younger than they are, so not because they wouldn't have been okay, but kidney diseases actually cause you to have poor growth, so they don't meet their developmental milestones. Reading is reading with difficulty. The speed of assimilation is very poor. So they may fail exams, and that would further make them depressed in addition to the problem of the kidney disease itself. So it's a whole gamut of problems. And then another problem is that they could have rejection issues because their parents will just get tired of them. Yeah. One look at their parents and they would know that inside that look is as if we wish we never had you type of thing. It's a lot to cope with. And he was actually very mild in putting the cost. It's about 400,000 on the average a month. So you're going to dialyze with about 4 to 5 million naira a year. And we are talking of close to 15 million naira in the 3 years that he has been dialyzing. And on the other hand, if he wanted to transplant, he will have to get somebody who will donate for him. And then in addition, he will have to look for 15 million naira to pay his bills. And that does not include the drugs he will keep taking. Because foreign kidney is a foreign kidney, and your body will try and throw it out, what we call rejection. And so you need to take medications that are very expensive to make sure it's not taken out. So the costs are actually terrible.
Okay. Now, talking about donors, let me just jump to that one. I watched a video. Yes, I like YouTube a lot. I'm always there. I watched a video on one of their medical shows, and the lady, I don't know if she was being partial, but she said women are most likely to donate, but they are most likely not to receive when they also want kidneys. People would rather give to men, and most people giving to men are women. So how is the donation level like in Nigeria, and what can we do to increase the numbers?
Beautiful question. Yes, you are right. Women usually are more likely to donate. We actually found that when you look at the male-female ratio of those who have kidney disease and those that donate, a lot of women donate for their husbands. Unfortunately, the same can be said of the other, vice versa, the other way around. But Nigeria has a problem. To enable you to be able to donate and get donors, you need a database. That is to say, all the details of each person that needs kidney donation must be put in a central database so that it can be accessed from any part of the country. So as soon as you see a match, you will know who you are going to give that kidney to. Unfortunately, we don't have that in anything. Let's hope with all this NIN and all these things we are doing, we may eventually end up having a database. Number two, we do not have electricity. If you are going to store a kidney for somebody, even for the 2-3 hours you need to do so, you need constant functioning electricity at every point, because you do not know when that kidney or where that kidney will be available. Somebody may have an accident in a village, and then you need to extract that kidney and then store it and transport it to where it is needed. We don't have transport systems. Some of these kidneys may be, somebody in Zamfara State may have an accident, and you check the kidneys are viable and can be used for somebody in Benin. Now you need to get those kidneys from Zamfara State to Benin in a matter of hours. We can't even travel in a matter of days, talk less of hours. So it creates problems for us. We can't use what they use abroad, which is cadaveric. People die, you remove their kidneys and store it for somebody who needs. So in Nigeria, most of the time, it is you having a living related donor or an altruistic donor. Somebody will say, I just like you, I want to give you one of my kidneys. And
did that exist?
It does.
Wow.
It does. People have offered. I have seen 2 people, one donated to his cousin and another one donated for his friend. Never mind that his father kicked him out of the house after that.
Oh no, the father will kick him out.
Kicked him out of the house.
Wow. So, but what can we do about, okay, electricity? Does this thing, I know they do a lot abroad. I don't know if Nigerians should start doing campaigns on it, where people who know they're about to die volunteer to give out their organs, their heart, their liver, their kidney, if those can also be transplanted. Well, do you think Nigeria can ever get to that level where someone says, carry everything inside and give to someone?
We can, but it's going to take a lot of work. We are still very superstitious in this country.
Very.
So can you imagine if a man who believes that he's going to reincarnate, and then you say he should donate his kidneys? He will feel that next time he's coming back, he will have no kidneys, he will have no heart, he will have no lungs. So he doesn't want to donate them, he wants to keep them. And then there's also another thing that happens, not only in Nigeria, but in a lot of African countries. We're a little bit still superstitious and fetish. Sometimes you believe that when they take your kidneys, they are likely going to do something with it, other than actually donating it to the person that you say they should donate it to. But education does a lot of things, and that's where you people have been very helpful, and we keep being helpful. Those in the media, they actually have the reach, they have the ability to change mindsets, and so we're going to be relying on you in the next few years to help change the mindset we have in this country. It would have been wonderful. A lot of people's lives would have been saved by the organs we bury. And but Nigerians are not just ready to change their mind yet.
Interesting. Okay. On women now, I know I've asked the question on women, but they are the focus today, and children. What has dialysis? What's the impact of dialysis on fertility? Is a man, is married, he has kids already. Does it affect the function of your what should I call it now? Fertilization. Your fertility. Can a woman undergoing dialysis get pregnant? If she gets pregnant, can she carry a baby while still undergoing dialysis? Can she have a family? Because most women, especially African women, if they never born picking, they never complete. Having children is very vital. Okay, so can that work for women?
It does, but it's very challenging, really very challenging. We've had some women that they're able to get pregnant and carry their pregnancy to term and deliver healthy babies, but the challenge is, it's serious. It means that that woman has to dialyze at least 3 times a week. It means that that woman has to live in a place where the combined resources of both the obstetricians and gynecologists, the pediatricians, and the renal physicians are available.
Wow.
And such centers are very few in Nigeria. Such centers are usually available where you have teaching hospitals. Like, it's possible to do that in Benin, it's possible to do that in Irua, but apart from Benin and Irua, I don't know what other place in those states such things are possible, except that person has to drive down all the time for checkups with the obstetricians, with the gynecologists, with the pediatricians, with the laboratory scientists and everything. So it means that the dialysis has to be very regular. It means that the blood pressure has to be so well controlled. It means that the blood levels have to be high enough. They have to take that drug he was talking about, erythropoietin, regularly, and it's very challenging, but it is possible.
Okay.
It is possible.
And so which is the major question for today, the theme for this year, how can women, children, humans in general who have kidney disease live healthy, have something close to a normal life, maybe before their transplant, and those who eventually will get transplant, what can they do to be healthy with their kidney transplants in place? So that's practically like 2 things in one.
Yes. They can live healthy lives, but like we said, it is for them to achieve a mindset that they can actually live healthy lives. They've got to, on their own, decide that they are going to be happy, and then they have to maximize the resources available to them. You find out that a lot of people with kidney diseases get depressed, and once they get depressed, we begin to have this problem that things that could have brought joy to them, they no longer participate in it. Things they could have participated in. Many people with kidney diseases do not agree to do a lot of social interactions. They just get depressed and they refuse. It takes you deciding on your own that you have to be happy to go for a friend's birthday. It takes deciding you have to be happy to take your medications on time, to make sure you go visit the doctors, to visit friends, allow the friends to visit you, and to look for the healthy foods you are told to eat it, and actually laugh. Most times, kidney failure patients, at times I go to the dialysis room and I don't see anyone laughing. Thank God you are smiling. they don't laugh. They are just moody, thinking of all the problems that are there. You can't blame them. In Nigeria, as a kidney failure patient, you bear the total cost of your treatment, except a friend or a family member gives something. So that is a terrible thing. But if they would control their blood pressures, control their blood sugars, take their erythropoietin so that the blood levels will be high enough, if they will go ahead and eat the healthy food they are told to eat, exercise, actually visit neighbors, take pains, stranger will say that, take pains to laugh, and you will find out that their lives will be better. There's so much that is available within the limits of the limitations kidney disease has placed on them. Yeah. That our message is that you may not have it all, but the one you have, maximize it.
Okay. Now, we know there are groups that are formed. I'm going to ask you this one now, Michael. There are groups that are formed for people who are alcoholics. So they come together to talk about their struggles, or maybe they're drug addicts. It's not rehab per se, but it's just like a group where you share your daily challenges, your triumphs, your failures, and encourage each other, because nobody knows your pain as much as someone who's actually going through the same pain. You can come tell me you're sorry that I lost a sibling. If you've never lost a sibling, you really don't know the extent of pain I'm feeling. And even as much as you've lost a sibling like me, our pain still will vary. So I think it takes one who's going through that situation to offer help to the extent that you would understand that he knows or she knows what I'm going through. So, but do you people have like an association where you talk about your problems, not just come together to only focused on how to generate income, but do you have an association where you talk about your problems, where you talk about ways forward, and maybe also how to generate fund?
Yeah, thank you very much. Actually, in 2019, an association was formed.
Okay,
Yeah,
that's new.
2019 years, they formed down. I don't know if there was association before, but 2019, association was formed. It's called the Kidney Patient Association. But let me surprise you, the people that have formed the association, the 4 of them, also 10 of them, they are all dead. None of them is alive today now. But the association is still on, and we have a WhatsApp group that will normally discuss and share ideas, talk to each other. At times they will call me to encourage the new ones, those that just started dialyzing, because some of them, they just think it's over, that they cannot make it, that when you have kidney disease, the next thing is just death. So I will talk to them. I'll add them to the WhatsApp group. So if you have any questions, you ask, but we encourage them one-on-one. Apart from the WhatsApp group, I'm always at the hospital, so I discuss with them one-on-one, make them understand that you can actually live well with this kidney disease. It's not a death sentence. Having kidney disease does not mean you're already dead, or that in just a year or 2 you will not be alive. We tell them that this person has been here for like 13 years doing this dialysis, so you can actually still live your normal life with the dialysis. So concerning the association was formed in 2019, so the association is still on, but where we normally talk is within the WhatsApp group. We have a WhatsApp group where we communicate to each other.
Okay. I would advise that you could get a little bit more political with your approach, and maybe begin to, if it's an association, get it registered, and begin to work to government offices and all that stuff to get aid. That's the function of associations, basically.
Yes, actually, that 2019, when the association was formed, 4 of them that are dead now, they were delegates that we sent to the governor, which is our amiable governor. The 4 of them met with Mr. Governor, and the governor actually saw what they were going through and promised them money for transplant, 34 million naira. He promised them just within the space of 3 months. We lost 3 of them within the space of 3 months. So it was left with only 1 person. That person kept pursuing the money until last year, December. The governor gave him 4 million naira, and he died in February this year. And even the money was not even enough for him to do transplants. So he was just still using the money for dialysis before he died this February. So it has not been easy. We are still trying, we are still writing to the governor to see how they can actually reduce the price of dialysis or incorporate it into NHIS, so that if we can be paying 10% of the money. So that's what we are trying to do.
Do you have any other thing you want to say before we go?
Yeah, what I want to say is, I just have an advice for the general public. Prevention is better than cure. The disease can be prevented. If you have diabetes or high blood pressure, just like the consultant said, you can manage it so that it doesn't get to this stage. Because when it gets to this stage of chronic kidney disease, I tell you, it's not easy. So it's better, the government can still come in by doing normal screening. Because if it happens that it now comes down to chronic kidney disease, we will still cry down to the government. So if they can be screening people, you can go for your normal regular checkup, so that if you have any ailment, you can treat it, control your high blood pressure, take your drugs for your diabetes, so that it doesn't get to that stage. Because they say the 2 major causes, are diabetes and high pressure that normally leads to this kidney. There are other causes, but the 2 major causes. So if you have this ailment already, you can manage it. Yeah, take your drug. But if you don't manage it properly, it will not lead to the next stage, which is chronic kidney. And when you get to chronic, there are a lot of things that go with it. Disease. Some people have this chronic disease, they don't hear word again. They now have ear problem or eye problems like coma. So many of it now affect the heart. All organs of the body, once the kidney is damaged, all other organs of the body is already at risk. They are going. It must get one down. It's not easy. So it's better, that's why you say prevention. Just manage yourself, go for your regular checkup. since we're still talking about the World Kidney Day, go for your regular checkup, because the World Kidney Day is to create awareness and sensitize the people all about the kidneys. So go for your normal checkup. If you have any ailment, try to treat it so that it doesn't get to the next stage, or it doesn't get to chronic kidney disease. Thank you.
Dr. J, before you give your last words on today's topic, I'll just ask a question which after you answer, you can add your last words on the show. For parents, you said something in one of your answers that it's not easy for parents who have children with kidney infections. The children can even just see the parents' face and feel like they want me to just die. They wish they don't have me. So how can these parents find help to deal with this situation they already have, plus the regular stress of the day-to-day living and maybe the other children they have? So where can they find help? What should they do to help themselves so they can help the children? And then your last words on the show.
Thank you. Yes, the parents would need a lot of help. The reason why the help is a little bit of a challenge is that the country already is a little bit stressful. And so what we advise parents to do is that if you would start by making sure that your children are free from kidney disease, if you would spend that 1,000 to check 3 children to find out these children likely to have kidney disease, you save yourself a lot of trouble. But once you've already known that one has kidney disease, one of the things you do as much as possible is follow the rules and regulations, encourage that child. Children that are well motivated actually live very long with kidney disease. They live better, they live longer than those who get depressed and get moody. You encourage that child, you will do well. You make sure that they go for checkups, you make sure that problems are detected early and problems are corrected. And then there is something that we do in Nigeria that we shouldn't do. We get ashamed. When you get ashamed of kidney disease, you die. So most people like to hide their problems. They don't tell a friend, oh, I have kidney disease, or my child has kidney disease. Because when you do that, some may not be able to do anything, but you never know that one person that will decide to do something good for you. We've seen it happen many times. There was one of my patients that he went to the village and he was mentioning that he had kidney disease, was saying it, and then one retired general came down from that same village and took a look at the young man and said, just let me know how much it will take to transplant you if you have a donor. Said, my sister is ready to donate. And then the general gave the young man 13 million naira check. Doesn't know him, they're from the same village, they're not related, and that enabled them to travel to India and get a transplant done. So you never know who will be able to help. Many of my kidney failure patients are able to dialyze today because they went online, put photographs of themselves dialyzing, put a doctor's report from us in UBTH, and then set up a GoFundMe account. And people put in money into that account, and they were able to dialyze. So it's something that the parents should do. Remove shame, bring out your problems, come out with it. Anything brought out into the open can be handled. Kidney failure thrives in darkness. That's why I said thank you again, because we are exposing it now. And the more it is exposed, the more we will find solutions to it.
Thank you so much, Doctor, and thank you, Michael, for sharing your experience with us. Like you said, a lot of people will now want to come out to say, this is what I'm going through. But we really need to begin to help one another. We're humans. My mom always used to want me to be a doctor. I would have been the crying doctor. I cannot handle a lot of things I see. But these emotions we're all carrying in us, these people are going through pain. You can take it further. Your 1,000 naira, your 2,000 naira can go a long way to help save your life. When we gather all of that together, someone could actually get the transplant that they need, or at least keep them going with the dialysis until the transplant comes. Let's try as much as we can to help save a life. I'm Daisy Leo Sikidi, but before I go, we'll just push play to our last video. Okay, no, I'm leaving now, so we'll leave you with that video of some habits that you might want to change for you to stay healthier with kidney infections, or to prevent it in general.
Our kidneys are two bean-shaped organs, located against the back muscles in the upper abdominal cavity, one on each side of the spine. The kidneys are a very important organ which filters toxins and excess water from our body. There are people who disregard the fact that we should take care of our kidneys. If we don't take care of it now, sure we will regret soon. Anyhow, in this video, we will show you 8 most common daily habits that damage your kidneys, which you should take care of. Starting with habit number